Yeah, that's right. I mean, for a while there, it was really easy to get a COVID vaccine. All you had to do was really walk into your local pharmacy. But shifting requirements from the federal government are really creating an extremely difficult situation for both pharmacies and patients to navigate.
Well, most Americans are going to be able to get it from their pharmacy for free.
But that hasn't been the case. The latest COVID vaccine comes with new restrictions and requirements established under Health and Human Services Secretary Robert F. Kennedy Jr. Pair that with the FDA narrowing down who they recommend should get the shot and a little-known Arizona law. Access to the vaccine isn't as easy as it once was.
Well, I went to my pharmacy first for the shot, and they said, no, I need a prescription.
Pharmacists here can't give vaccines unless they're recommended by a CDC panel called the Advisory Committee on Immunization Practices. This shift has patients like Linda Pliwa jumping through hoops.
The person I usually see at my doctor's office wouldn't write a prescription, so I had to get a PA that would write a prescription. And then I went right over to Walgreens and got the shot.
Arizona is one of 16 states where this is happening.
I was upset because my husband and I are going on a cruise in a few weeks. And I don't want to delay getting it because we really want to be protected before we get on the ship.
For Carrie Good, the politics and policy debates don't matter. What matters to her is simply getting access.
If you don't want to be protected against it and you're willing to take the risk of getting the flu, possibly getting very sick, that's fine. But if people do want the vaccine, they should be able to get it without having to jump through any hoops.
Good's friend and neighbor, Kathy Quellen, hasn't been so lucky.
And I'm going on Monday to a different practice. I have to change my whole doctor, who I went to for 15 years, just to get a prescription for a COVID vaccine that last year I just walked into the pharmacy and got.
Until the CDC panel weighs in on the latest COVID shot, Arizona pharmacies are caught in the middle, which means patients are too.
When the CDC meets on the 18th, what do we do if they don't recommend it? Then will my insurance not cover it?
So medical experts say the best thing to do is to call your doctor and ask for a prescription. That extra step should pave the way to your vaccine. Reporting live in the studio, Alexis Dominguez for Arizona's Family.